One of my aunties came and asked me, Santosh, is there a link between heartburns and esophageal cancer? Not all heartburns may lead to esophageal cancers, but significant number of esophageal cancers have heartburn in their history. It may seem confusing, let me explain it to you. Heartburns basically means a foot pipe which basically runs from the throat till the bag, which is the stomach, is getting exposed to the acid which is produced in the stomach. Now, between the foot pipe and the stomach, there will be a valve called as lower esophageal sphincter. It is a unidirectional valve and it has to open downwards only when food is coming from above downwards. Whereas in few people, this has to close regularly if acid from below is trying to enter into the esophagus, but it will not close effectively, and from stomach acid gets exposed to the esophagus because of the ineffectivity of this valve. Now this keeps happening in normal people also, and normal esophagus clears it off. Now if the esophagus is not able to clear it off, or the lower esophageal sphincter is not effective in controlling the acid from going upwards, then heartburn occurs. If this heartburn is not attended properly, for example, one has to do some lifestyle changes like reducing oily and spicy food intake, reducing citric fruit intakes in empty stomach, reducing tea, coffee and empty carbs, having dinner early, sleeping with head end elevated. All these things may reduce the heartburns. In addition to this, patient, if he or she is taking acid lowering tablets, heartburns will definitely come down. But if someone keeps ignoring heartburns, because again heartburns is a perceptional thing. Some people will come to a doctor even with small amount of heartburns. Some people may not consult a doctor because they will consider, okay, this is normal process only. If the later one happens over a period of decade, more than 10 years, the esophagus, which is getting exposed to acid chronically for a very long period, turns itself into something called as Barrett's esophagus. In that, cancer cells can start developing. Barrett's esophagus can progress into low-grade dysplasia, high-grade dysplasia, and into adenocarcinoma, which is a kind of cancer. So this kind of adenocarcinoma cancer was very common in the Western population because of their lifestyle. In India, the other kind of cancer called as squamous cell carcinoma was commoner earlier, but these days because of our imbibing of Western lifestyle, adenocarcinoma, which happens due to gastroesophageal reflux disorder, is also becoming common in India. So GERD can be easily reversed with certain lifestyle changes or prescription from the doctor to take acid lowering medications. If one is not following this and letting the GERD continue for decades, then yes, there is a definitive risk of this esophagus, which is getting exposed to acid, may slowly turn into cancer.